Infant spitting up is the effortless return of milk after feeding and is generally normal. It happens because the valve between the esophagus and stomach is not fully developed. Spitting up can worsen if an infant eats too fast or swallows air during feeding. This phase is temporary and typically stops between the ages of 7 and 12 months. To reduce spitting up, burp your infant every 4 to 5 minutes during feeding. Also, maintain an upright position for the infant during and after feedings to aid digestion. For bottle-fed babies, ensure the nipple allows only a few drops to come out. If spitting up causes discomfort or interferes with growth, it may indicate gastroesophageal reflux. If the spit-up material is green, this indicates the presence of bile and requires attention. Similarly, if the material contains blood or the infant is coughing or choking, seek medical help. While typically harmless, it is critical to seek medical advice if warning signs appear.